everybody, I am Thatnursingprof and welcome to my channel. In today's video, we're going to be talking all about confidence, okay? And how are we going to build our confidence as a nursing student in nursing school? From my observation, what I've noticed with my students is they lack confidence in three main areas. So it could be test taking. So they go back and they second guess all of their things and they go and they erase it and they put in a new answer and the first answer they chose was actually the right answer. In the skills lab, when we're learning new skills like putting in a Foley. And then finally in the clinical setting. So sometimes they are nervous and afraid and shy with talking to the patients, talking to the nurses, the CNAs, the doctors, whomever, right? So those are the three places where I see a lack of confidence in my students. And so I wanted to make this video to address those things, some in a more specific and some in a more broad manner. These are kind of like my tips and tricks about how to build confidence in nursing school. I don't want you to equate confidence with perfection, right? Because nobody expects you to be perfect as a student. So don't expect yourself to be perfect either. Don't be afraid to ask questions if you don't understand things. A confident person is not afraid to ask questions and to ask for help. Your nursing instructor in clinical, your teacher, or who's ever helping you out in the lab, all of those people, our job is to help you get better so that you can provide the best possible patient care. So don't be afraid to ask questions. That's what we're here for. When it comes to building your confidence in the skills lab, it's all about practice. Truly, the more you do it, the better you'll get at it. It's your first time, these are new skills. Nobody expects you to get an IV on the first try right away. Nobody expects you to do a Foley and never break sterile field the first time for practice, right? This is just practice, this is new, it's a learning experience. You're not being judged at this point, right? Unless it's like a skills checkoff situation. This is all about you getting better. And I notice some of my students, when they are really good at the skills, like some of my students initially are really, really good at vitals because they do it at work already. So they're like, oh yeah, I can do vitals, I can take a manual blood pressure, I can do a blood sugar, I don't need you to teach me that. And they kind of come in with like this little confidence to them because they've got those skills down already. So confidence does come from knowing your stuff, okay? So lots of practice, getting those skills down, it's gonna make you feel a lot better. Stop comparing yourself to other people. I know we live in a world where we just do that all the time, right? You compare yourself to the people on TV, on Instagram, and all of that stuff, right? But you can't compare yourself to others. Don't compare yourself to the student that has, a 4.0. Don't compare yourself to a nurse that you're in clinical with, that you're shadowing, who's been a nurse for 25 years, okay? Nobody expects you to be that way, okay? Do the best with what you got, okay? Do the best that you know you personally can. Do not compare yourselves with other people. This is not a competition, okay? We're all here to learn and grow together. Having confidence in your decision-making skills takes time. Literally. The situation will happen, and what should you do? You should take some time before you react to it. Right? So think about all the possible consequences, things that could happen to you, things that could happen to the patient. You can use this on taking tests, you can use this in clinical, you can use this on lab performance, whatever you're struggling with. Just take a time, take a breath, pause, and think about, the potential consequences of your choices and your actions. In nursing school, you're lucky because you're not going to be given any, emergency situations where you have to think that fast, right? Critical thinking is a new skill, you're learning it, you're getting better at it, and this is what you do. This is how you practice it. So pause, take the time, think about the possibilities, and then make a decision. And once you do, that's going to build your confidence up in your ability to make those kind of decisions in a real world situation where you don't have enough time. One way to build your confidence is to track your progress. So that could be, tracking your grades, tracking how you're doing at a skill, or tracking how you're doing in clinical, asking for, feedback from your clinical instructor. You want to set goals and make sure these are realistic goals that you can obtain. For example, if your confidence comes from the test, okay, test taking anxiety, and you're going back and changing all your answers, make your goal, on this next test, I'm only going to change 2 of my answers, or I'm not going to change any of my answers. I'm going to keep my one answer that I chose originally, and I'm not going to go back to it. I'm not going to second guess myself. If that's a realistic goal for you, try it out. and then see what happens. You don't change anything, you get it back, you get a good grade, you're going to feel more confident in your ability to take that test. When it comes to building confidence in clinical, you want to be prepared. So if you're going to be doing a skill or a procedure, making sure you have all of the equipment you need before you enter the room. Because when you're walking in and out, oh, I forgot this, and oh, I need to go get that. It makes you look like you don't know what you're doing. So the patient's not going to be confident in you, they're going to question you, and that's going to decrease your level of confidence. So making sure you're prepared and you have all the things you need. Also, just normal interacting with the patient. When you first meet the patient, you're not going to go in blind and not know anything about them, right? What do? We review the chart, review the medical record, get some sort of baseline knowledge on the patient. That's going to help you feel better for when you go into the room and start interacting with them. It's going to help build up your confidence when it comes to your communication with that patient. Identify your weaknesses. And I know you're probably thinking, hold on, how is pointing out the things I'm bad at going to make me feel better about myself? So here's how it works. You need to identify the things you struggle with the most, right? Point out your weaknesses, and then you're going to work really hard to get better at those weaknesses. Confidence will come from getting better at things you struggle with, right? Confidence doesn't come from doing something well that you've always done well, right? It's from overcoming an obstacle, right? So I'm terrible at Foley's. I'm not good at them. I never get them. The more you do them, the more you practice, now all of a sudden you've gotten a lot better at them. You're doing a great job. You go to skills check off and you get 100%, right? That's going to boost your self-esteem. That's going to boost your confidence in your ability to do that skill. So identify your weaknesses and then focus on ways to improve them. Work on your weaknesses. In addition to identifying your weaknesses, you also want to identify your strengths. What are the things you're good at? Make a list of all the things you're good at, the things that you've successfully completed or that you understand. When you're studying for an exam and you make flashcards, right? You go through your flashcards one time and what do? You make the two piles. This is the I know it pile and then I don't know it pile. And when your I know it pile starts to get higher than your I don't know it pile, doesn't that make you feel better, right? It makes you feel more confident in your ability to understand this information. So list your successes, even if you physically need to write them down. I am good at this. I know how to do this. And review them. Keep them on you. Keep them on your clipboard or something like that for clinicals, because that's going to make you feel better and it's going to make you more confident in your ability to do things. When it comes to confidence in communication, with like the patient or with the nurses or even with your nursing instructor, here's the little secret about that. Therapeutic communication, the best part of it is listening, okay? So it's not even you talking, it's you listening and listening actively to what they're telling you. So people will appreciate that. Your patients, the nurse, your teacher, your classmates, anybody you're communicating with will appreciate you actively listening to them. So being a good listener, being a sponge, absorbing everything around you, right? That's how you're going to get better at communicating with your patients. And I will tell you something I used to do when I was in school. I was very shy. I was very shy as a nursing student. I was nervous to talk to people, and I would kind of like give myself a little pep talk before I walked in the room. I would knock on the door and I'd say, "Hi, it's the nursing student. Can I come in?" And then I would be like, "Okay, take a deep breath," and say, "You got this, you can do this, take care of this patient, you're gonna do a great job today." And I know that's kind of dorky and silly and weird, but it does help. So kind of give yourself that little pep talk, like you got this, you know what you're doing, and you're gonna do a great job. And it will help you do a great job. One thing I don't think we talk about enough is your social group and the people you're surrounding yourselves with. I know in nursing school there's a lot of people who are overly tired, they're exhausted, they're super anxious and stressed out. I get it, right? I've been there, I was there. But surrounding yourself with positive people, being in a positive environment and having a positive mindset is really good for your confidence. You're going to feel better about the things you know, and you're also going to feel better about the things you don't know yet, right? You're not going to walk into a situation and say, "Well, I don't understand this, therefore I will never understand it." No, right? Don't think about it that way. I don't understand it today, but eventually I will. Eventually, if I keep trying, I will get it. So think positively and surround yourself with positivity. The last thing I wanted to mention in this video is to just be kind to yourself and give it time. It's okay. All of those negative voices in your head saying like, "I don't get it, I'll never get it," ignore them. And in fact, replace them. Replace them with positive voices and, encouraging thoughts. So I hope you found this video helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.